My stomach hurts. I feel nauseous. I have heartburn. Your healthcare provider might start you on a medication called omeprazole to help with these symptoms. This video will look at the 12 most frequently asked questions about omeprazole. Coming up. Hi, I'm Dr. John, board certified in internal medicine as well as geriatric medicine. This channel is here to promote your health and well-being. Think your health. Omeprazole belongs to a family of medications called proton pump inhibitors, PPI for short. Omeprazole reduces the amount of acid in your stomach. The brand name is Prilosec. What is omeprazole used for? It is used for up to 4 to 6 weeks to treat heartburn and other symptoms that can help with gastroesophageal reflux disease. GERD for short. GERD happens when acid in your stomach backs up into the tube, your esophagus, that connects your mouth to your stomach. The most common symptoms associated with GERD are burning in your chest or throat, burping, or sour taste. What are other disease entities omeprazole can be used for? For up to 8 weeks to heal acid-related damage to the lining of the esophagus. This is also called erosive esophagitis. For up to 8 weeks for healing stomach ulcers. For up to 8 weeks for the healing of duodenal ulcers. The duodenal area is the area where food passes when it leaves the stomach. These ulcers are sometimes associated with long-term use of NSAIDs. NSAIDs can irritate your stomach lining and the duodenum lining. With certain antibiotics to treat an infection caused by bacteria called H. pylori to help eradicate this bug. The infection needs to be treated to prevent the ulcers from coming back. For the long-term treatment of certain conditions where your stomach makes too much acid, such as a rare condition called Zollinger-Ellison syndrome. It is also used off-label to treat Barrett's esophagus when the inner lining of your esophagus gets damaged by acid reflux. The starting dose here would be 20 milligrams daily, and the current recommendations is to take omeprazole long-term for this disease entity. Acid is produced by proton pump in your stomach. Omeprazole works by turning off and blocking these pumps, and as a result of that, reduces acid production in your stomach. Take omeprazole exactly as prescribed by your healthcare provider. Do not change your dose or stop Prilosec without talking to your doctor or your healthcare provider. I'll explain later in this video. Take omeprazole at least 30 to 60 minutes before breakfast. Swallow omeprazole capsules whole. Do not crush or chew omeprazole capsules. If you have trouble swallowing Prilosec capsules, you can carefully open the capsule, mix the pellets with a tablespoon of applesauce, and swallow the water. It starts working within an hour of dosing, with the maximum effect occurring within 2 hours. It can last up to 72 hours. Acid levels return to previous levels within 3 to 5 days of discontinuation. Do not stop omeprazole or any other PPI without talking to your healthcare provider. What might happen is that you might get rebound acid hypersecretion. In rebound acid hypersecretion, there's a reoccurrence of symptoms after stopping PPI therapy due to an increase in gastric acid secretion, even above pre-treatment levels. Omeprazole should be prescribed at the lowest dose and for the shortest duration for the specific medical condition. It is never intended for lifelong treatment. If you have been treated for a longer period, mind you, this is not clearly defined as how long, but usually it's around 2 to 6 months. Your healthcare provider should consider tapering the dose of the medication. As I mentioned earlier in this video, certain disease entities where long-term maintenance treatment will be considered by your healthcare provider. Next week, I'll have a video on how to stop or taper omeprazole. Click right here. The several drugs which can interact with omeprazole, and this list is by no means exhaustive. Here are some examples. Clopidogrel. Omeprazole can decrease the activation of this drug. Antibiotics such as clarithromycin, amoxicillin, rifampin, antifungal medications. Methotrexate. This is a drug used for certain rheumatological and immunological conditions. Phenytoin, an anti-seizure medication. Diazepam. This is also known as Valium. St. John's wort, a blood thinner called warfarin. Abdominal pain, nausea or vomiting, bloating, constipation, diarrhea, headache, skin rash. If you have any of the following side effects, tell your healthcare provider right away. Symptoms such as an unusually fast heartbeat or slow heartbeat, or even palpitations, muscle spasms that don't go away, seizures. All of these could be indicative of a low magnesium level. In fact, a very low magnesium level could lead to a condition called Toussaint de Poix, which can be fatal. It is a fatal heart arrhythmia. If you have a rash on your cheeks, nose, joint pain, this could be indicative of signs of lupus. Tell your doctor right away if you develop the following symptoms: persistent diarrhea, abdominal pain or cramping, fever, blood in your stool. This medication may rarely cause a severe intestinal condition. The intestinal condition is called C. diff colitis, and this is caused by a type of bacterium. If you develop the following symptoms, such as unusual weakness, especially of the lower extremities, sore tongue, numbness and tingling of the hands and feet. All of these could be signs and symptoms of B12 deficiency, especially if you use proton pump inhibitors such as omeprazole daily for a long time. You may have symptoms such as rash, itching, swelling of the mouth, tongue and face, difficulty breathing and swallowing, and all of these could be signs of an allergic reaction. Get medical help as soon as possible. Long-term PPI use can decrease bone density. This is also called osteoporosis. The FDA has warned about possible increased risk of fractures of the hip, wrist and spine. Long-term PPI use also has been associated with an increased risk of incident chronic kidney disease, CKD. How this happens is not really known. Further studies are needed. PPIs can also cause acute interstitial nephritis. Signs are usually fever, rash, blood in the urine, and confusion. You can treat this condition by stopping omeprazole, the offending medication. This is not a complete list of possible side effects. All drugs cause side effects. There will be always some people who have no or mild side effects. Others may have moderate to severe side effects, leading to discontinuation of their medication. If you do have side effects, talk to your healthcare provider for next steps and advice. Current recommendations in older adult is to avoid scheduled use for more than 8 weeks unless for high-risk patients or with patients with certain medical conditions such as erosive esophagitis, Barrett's esophagus for example. Especially in older adults, there's an increased risk for fractures and C. difficile associated colitis. Although some studies have found an association between use of PPIs and dementia, others have not found an association between PPI use and cognitive function. More studies are probably needed. Can omeprazole cause small growths in the stomach? If you've been on omeprazole for a long time, you have the risk of growing a small growth in the stomach. Medically, we refer to these growths as gastric polyps. These are reversible and are mostly asymptomatic. Therefore, take this medication, omeprazole, only for the recommended time suggested by your healthcare provider related to your specific condition. And if you're interested in other videos, click right here or click right here. Have a good day and think your health. Oh my God! Oh, my phone fell. So this was my second take because I did the previous. I don't know why does this happen before. Hopefully this audio is working. I see that the battery is blinking.